Hello, I'm Dr. Ian Strawford and I'm the Medical Director of Skin Excellence Clinics. Welcome to this Q&A session. I'm going to share with you lots of questions that I'm often asked when patients are coming to have a consultation with me.
I have xanthelasma affecting my eyelids. What causes these and how can they be treated?
So xanthelasma are an unusual condition, but they're not uncommon. This is where you get deposits of fat in just superficially underneath the immediate top layers of skin. And they appear as sort of white, yellowish streaks or plaques, and they tend to occur predominantly in the eyelids, the upper and lower eyelids. Why it happens is not clear, but there is an association with these xanthelasma with lipid or fat metabolism problems. So they're very common in patients who have genetically very, very high cholesterol levels, familial hypercholesterolaemia. And in those patients, they really, if they've not been identified as having that lipid metabolism problem, they must be seen by their GP or health practitioner because they are at very high risk of cardiovascular disease. But in my experience, there are a lot of patients who suffer with xanthelasma who don't have very high blood fat levels. Sometimes they're associated with diabetes or other metabolic diseases to do with the sugar metabolism, but often they appear in healthy individuals with none of these conditions. We just don't know why they appear. They're unsightly and cause people a lot of distress. They don't cause any symptoms other than the appearance. They're not irritated or red or uncomfortable, but it's more the appearance that really distresses people. The treatment for xanthelasma, there are different treatment modalities out there that include CO2 laser, chemical peels, or even surgical removal of these fat deposits from the eyelids. But we like a treatment that we do quite regularly in the clinic, which is called radiosurgery or radiofrequency. This is an ablative treatment. So with a little bit of local anaesthetic injected, we can very carefully destroy the fat underneath the skin and allow the skin to heal with a really nice result, so that after the healing process, then there is less or zero visible fat beneath the skin. Unfortunately, xanthelasma can come back and you may need retreatment, or if the fat is very deep and very thick, then we may not be able to remove all of it with radiosurgery, and in those cases you may need more formal eyelid surgery to treat it.